The most pressing global health challenge we have today is the inequities in the world. We're leaving half the world behind, and we have to understand that we're all in this together, and we can't just not care of what happens and people in faraway countries of the world.
Ultimately, what we need to realize is that we give the most appropriate health care to everyone on this planet, no matter where they live. That, to me, is the ultimate goal of global health.
The most obvious systemic barrier to access to health is the lack of financial means. Then there are other barriers like cultural barriers, and there are geographical barriers.
The barriers to access to healthcare are many and complex. For example, most of the innovative drugs that come to the market today never are registered in half the countries in the world. And on top of that, if you manage to register the drug, many of these countries do not provide reimbursement, or there's no access to universal health care. And this is where affordability becomes a problem.
When you design a project, you need to make sure that the populations that you include in that are representative for the country or the community that you actually try to help with this intervention.
It's important that we realize that the barriers to healthcare can vary and are very much depending on the situation in which we analyze them. And the way that our teams go about it is by adopting what we call the patient journey, which means a patient feels symptoms. What is it they do? What is that journey essentially to health care, or you could also call it health-seeking behaviors? And then depending on the society, depending on the disease, depending on other factors, you may identify those individual barriers. And it's important that we spend a lot of time in diagnosing those barriers and then co-designing with society effective solutions, because there is ultimately no one fits all. And those barriers can be very specific and unique.
But availability of these drugs in the market even does not solve the issue, because the next layer of issues that we have is access to diagnostics.
It is crucial to involve communities and people affected by health problems in the design of health systems and in the design of health policies.
It is important that we look at the medicine as just one part of a much bigger solution that needs to be in place. And that leads to the notion of partnerships, that it is so important that we realize that the private sector can make a contribution, but it's ultimately not the private sector solving the problem alone.
You need to actually involve people that are going to receive that innovation already at the beginning, so to get those voices in and help shape the program and the project so that it can be built into the design of the program. If you have all those actors, both those who will develop but also those who will benefit, I think that's a strong foundation for a partnership.
What makes a public-private partnership successful is to find all the necessary stakeholders within the disease space and allow them to find the common ground to make sure that at the end, the goal is to make sure that patients can have access to the treatment that they need, no matter where they live.
Let me take an example, and that would be sickle cell disease. As you know, it's a genetic disease that disproportionately affects people living in sub-Saharan Africa. A child born in the United States today with sickle cell disease has a very good chance of living into a healthy adulthood. Whereas in sub-Saharan Africa, we have a mortality rate of children below 5 years of at least 50%, and the numbers vary here.
There needs to be a pivot in our thinking in the global health architecture, in national health architecture, and then in the innovation or innovative approaches to each step that gets a new health technology from the bench to the bedside. Health systems become sustainable and efficient in a number of ways, the most important of which is that health is seen as an investment and not as an afterthought or some kind of charitable mechanism for providing for the needs of people.
I think we need to reframe the way how we think about health expenditures and rather look at those as an investment into the future of a society, of a nation, of a country. Because it's very obvious that good health drives to greater productivity and ultimately to greater prosperity.
There are many calls that I would like to make. I think one is one of the foundational investments and the commitment to universal health coverage. If you think about equity, if every nation around the world committed to universal health coverage, and one of the most important elements is primary health care.
What I ask of everyone in the community, every single stakeholder, is to understand that the humanity of every person in the world is the same, that all we want for ourselves and our loved ones is to be able to have the opportunity of health and the chance to go through our journey with dignity. And so we must work together and focus on those who need us the most, because we will need them as well. We are all one in this world, and we must find solutions together.